Welcome to the Patient Assessment Medical Skill Station. In this skill, you will have 15 minutes to perform your assessment, patient interview, and voice treat all conditions discovered. You must conduct your assessment as you would in the field, including communicating with your simulated patient. You may remove the simulated patient's clothing down to his or her shorts. As you progress through the skill, you should state everything you are assessing. Specific clinical information not obtainable by visual or physical inspection. For example, a blood pressure must be obtained from the simulated patient just as you would in the out-of-hospital setting. You may assume you have 2 partners working with you who are trained to your level of care. They can only perform the interventions you indicate necessary, and I will acknowledge all interventions you order. I may also supply additional information and ask questions for clarification purposes. Do you have any questions?
I do not.
You respond to a 56-year-old female who has had shortness of breath for the past 4 hours. She called 911, and she is sitting on the edge of the bed when you arrive.
PSIP, my scene is safe. Nature of illness, I was called here for a difficulty breathing. Number of patients is 1 as far as I can tell. I'm going to go ahead and request additional EMS support, and I can always cancel at a later time if not needed. My patient is sitting. Did you fall at any time before I came here?
No.
Okay, so I don't need to consider C-spine. I'm going to go ahead and verbalize my general impression, and I need to know just like, how are you feeling today?
Pretty bad.
Okay, can you tell me what's going on?
Just really hard to breathe and tight in my chest.
Okay, all right. Well, I know that we got called here for difficulty breathing, and my general impression would be that we have somebody who has a patient that's having difficulty breathing. Level of consciousness, my patient's awake and alert, speaking to me. Chief complaint would be difficulty breathing, correct?
Mm-hmm.
Okay. So I'm going to go on to my ABCs. So my airway, I know my patient's airway is open and patent. Breathing, I'm going to go ahead and check patient's breathing and also connect SpO2. One more time.
Your patient has diminished breath sounds in all fields. She's breathing at 30 breaths per minute, and her SpO2 is 88%.
Okay. I'm going to go ahead and throw on a non-rebreather at 15 liters per minute, and I'm going to move on to circulation, check some radial pulses, and also do skin assessment at the same time.
Her pulse is 120 beats per minute, and you note pink skin that is warm, but that there is cyanosis around her fingertips.
Okay. So her breathing and circulation are concerns to me, and I want to make an immediate transport decision by immediately transporting. So I would like to immediately transport. I'm going to go ahead and ask you some more questions. So when did this start?
About 4 hours ago.
Okay. Is there anything that makes it feel better or worse?
Whenever I walk around, it seems to get worse.
Okay. Can you describe the feeling?
It's just really hard to breathe.
Okay. Does the breathing, are you just having difficulty breathing, or is there any sort of pain that's going anywhere else in your body?
No, just difficulty breathing.
Okay. And is there pain associated with the breathing?
No.
Okay, so if I asked you a pain scale, 1 to 10, 1 being minimal, 10 being the worst.
I'd say as far as the breathing goes, definitely a 10.
Okay, so it's hard to breathe. Okay. And has this ever happened to you before?
It's happened before, but it went away.
Okay, all right. And do you have any allergies?
No allergies.
Okay. Are you on any medications currently?
I just use an inhaler.
Okay. And you said this happened before. Have you ever been to the hospital for anything like this before, or been hospitalized for breathing problems?
No.
Okay. You ever had a heart attack before?
No.
Or a stroke? Okay. When was the last time you had something to eat?
It was last night, and today I just really haven't had much of an appetite.
Okay. And what were you doing when this all started 4 hours ago?
I was actually laying down.
Okay. All right. And does it feel better when you're sitting up?
A little bit. Better than when I'm walking around.
Okay. All right. I'm going to go ahead and move on to my secondary assessment. And I want to get a set of vital signs. I'll start with blood pressure.
Her blood pressure is 160 over 92.
Okay. And also can I reevaluate vital signs? Was it pulse I got before? Can I get another pulse?
Her pulse is 116 beats per minute.
And what's the SpO2 now that I have the non-rebreather on?
The SpO2 is reading 91%.
Okay. And breaths per minute again?
She's breathing at 24 breaths per minute.
Okay. So the non-rebreather isn't working as well, so I'd like to go ahead and like to put my patient on CPAP, and at between 5 to 10 centimeters of water, or until basically titrating to effect until my patient receives comfort. My field, I'd actually like to also place an IV at this time, gain IV access, and 2 TKO, and I'd like to get end-tidal CO2 attached to the inline end-tidal CO2 on the CPAP. What is my end-tidal?
Her end tidal is at 32.
Okay. My field impression of the patient is that they're suffering from difficulty breathing or some sort of airway obstruction, and I would like to this is about the verbal. I'd like to reevaluate during transportation every 5 minutes, and I would also like to get an EKG while I'm in transport on the way there. So reevaluate every 5 minutes, get a reassessment of vital signs, and repeat my secondary assessment.
Her repeat vitals, her blood pressure is 168 over 94. Her pulse is 108 beats per minute. She's satting at 96%, and her respiratory rate is 20 breaths per minute.
Okay.